2011. I'm 2 weeks post-op from my chest surgery. Yeah, chest surgery went fine. I had a nurse trip over my drainage tube in recovery and was sent back home to be sent back. I don't remember any of it, thank God, because I have a hospital phobia. But I was sent back to the hospital emergency for because I lost half my blood due to a hematoma in my chest cavity. But other than that, that was all in a 24-hour span, and I'm doing fine, healing up fine, stuff like that. And you know, I started binding again. This is what this is. I stand up to show you, but I'm still shy with my chest. You can kind of see these binders and stuff. They strap on somewhat kind of like a bulletproof vest, and they're very tight and very uncomfortable, very painful. And I take it off for a few hours a day and shrug at the sight of having to put back on. It actually starts to shake. But anyways, that's that. Everything's going well, and I'm happy, and surgery went well. It's looking good. I'm healing up good. But one thing that's kind of bugging me is the support that I'm getting from people. I'm getting support from the people that I didn't think I would get support from, and people that I didn't think that would understand, because I identify as a straight male. I lived for years, 10 plus years, as a lesbian, and that was just a makeup, a cover up for, I'm basically a boy sucking a girl's body, a man sucking a girl's body. So I'm in my 30s and just came out and stuff like that, and it was, obviously it was a shock to a lot of people, but I'm finding a lot of coming off kind of like racism and low blows from a lot of people, and it's mostly people in the gay community, which is kind of shocking to me, because these are people and friends that I've known for 15, 20 years, and just things like they won't talk to me, or this or that. But whatever, I'm not letting it bother me, because if I'm going to let it bother me, I'm going to drive myself up the wall, and there's no point in letting it bother me. So there's only one way to look, and it's one way to look, and it's up, and it's like, so 9 months on T, and 2 weeks post-op, and yeah, doing good. Still a little sore and stuff like that. The binding is something else. I thought I had felt pain before, and I have a very high pain tolerance, but binding is very painful, very, 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 very painful. And and I'm in this vest for up to 18 hours a day. Take it off for 3 hours a day to rest, and then back on. And one thing that I wasn't impressed with also after surgery was that people that know me well know how much of a clean freak I am. And I was told that you can't shower for 2 weeks after surgery, that's because of complications, because the grafts and nipples and stuff like that, if they get wet, they can fall off for infection and so on. So sponge bathing, so it's just like, oh my God, something else. And then being really sore and not really being able to lift your arms very high, and same with just very sore, and like pulling things, not even, like my laptop, for instance. I can't even lift my damn laptop onto the thing because it's too heavy. I'm not allowed to lift anything. I'm not allowed to, because of popping stitches and stuff like that, or hurting my chest. So it's like, thank God that I have a roommate and friends that are willing to help me out with this stuff, because for the first few days it's fairly tough. Like the simplest thing, you don't realize how much you use your chest muscles. So till you have a surgery like that, like I think open heart surgery would be a breeze compared to having this done. And that's what I was told by the nurses, because I couldn't even pull up, when I came out, I couldn't even pull up my pants by myself. I just started go to the washroom, and I'd have to get somebody to pull my pants up I had to have everything done, and I still have. They gave me these ridiculous drains, and I still have them, and the size of these. So I'm still carrying these two drains around, and they look like fixtures the size of TV players. So everywhere I go, I've got to carry these suckers around and tuck them in to my jacket. And I've gone to a few stores where it looks like security was just about to pull me over, pull me in to see if I was stuffing stuff in my hoodie, because it looks like from far, yeah, it does look like you're hiding something and you're holding them, because it's like, oh, and it just drains the liquid from the leftover liquid that's in my chest and stuff like that, and so on and so forth. I'm not too comfortable with showing you my chest right now, because I still have a lot of swelling and stuff like that, and a lot of fluid in there. So maybe next time around I'll be more comfortable with showing you guys my chest, and once I'm a little more healed up and stuff like that. So, anyways, I was just gonna drop in a line and stuff like that, maybe in a video, and yeah, that's it. So it's like, yeah, that's but there's nothing else to say. I'm still very exhausted, very tired, still getting some rest and stuff like that. But getting that rest and getting some help and stuff like that, and it's great. And thank you for the people that have supported me, and it's greatly appreciated and stuff like that. So, and yeah, so I guess I'm gonna leave it at that, because I'm kind of speechless today, and still very tired and still in a lot of pain, and you know what pain can do to your head. It's just kind of, just, yeah, exactly, just like that. So, anyways, I'm gonna let you go on that note, and I'm sure we'll talk to you guys soon. So take care and cheers. Have a good one.